lab. So blanket warmers, sheet warmers, so we can grab something warm for them. We do take their gowns off, okay, and have them, they're pretty much in their birthday suit underneath. No underwear, gown off, naked underneath this sheet. So again, we do want to maintain their modesty as much as possible, but we do have to expose the groin. So, hi Mr. Jones, my name is Lisa. I'm going to be preparing your leg here for the procedure. I'm just going to uncover you a little bit. And I don't want to do that, okay? So I want to be gentle and I want to just kind of push over, okay? Now, very close to private areas, all right? You're going to see some of them. Some of them, and I didn't say this in the last lab, and I'm kind of glad I didn't because the guys were in there, because I get a little embarrassed. But sometimes you've got some penis issues where they actually want to kind of stick over and be over. And so the best way to deal with that is just to kind of take the sheet and just kind of like try to tuck it and push it back, okay? I've seen people with implants, penile implants, and so it looks like they have an erection, and so you have to kind of deal with that. And again, you want to be as careful and modest as possible, but you do have to get a good area here exposed, okay? Now, if they tell me it's radial, then I'm going to do radial. There's usually a board that we put and we kind of slide up underneath where we put the patient's arm. We may put some towels underneath, maybe even a roll that kind of makes their arm hyperextend a little bit, and a lot of times we actually tape their hand down so that they're not able to lift their hand. When you read, this is all in chapter 2 in Kern. He talks about the setup, some of the setup. When we first started these, we would have the patient with their arm totally extended out like this, which I can't extend his arm, but it would be all the way out here. We had to have this board. It was just very awkward for the whole procedure. And so most people these days, they use these little boards, like I said, and they keep the arm close to the patient, maybe just elevate it a little bit so that the doctor still kind of has the same working ergonomics position as if they were actually working from the femoral area, okay? Either way, it doesn't matter. What if they tell me they want me to do both groins, okay? So there's a couple ways I can do that. So I could take the sheet and go down the middle to cover their privates, and then I would have both groins exposed. The way I like, that's kind of bulky to me, so I like to do it a little bit different. I like to grab another sheet. Especially, if it's a female, has no bra either, nothing. As modestly as I can, I'm just gonna kind of put a sheet on top, and then I'm gonna get something, maybe of course, a clean towel. The scrub tech may hand it to me. You could use a washcloth. You could use, sometimes people don't, when they're scrubbing, they don't use the little white cloths that come in and we save them. They come in, just whatever you need. But I'm just gonna give you a little loincloth here. I'm gonna kind of uncover you down, but you'll have something down the middle, okay? Okay, and then try again to cover them down the middle to the best of your ability, okay? And keep their body covered as much as possible because it is pretty cold. But you'll have some people that are trying to reach up and cover because this is all cold. Some places we restrain their hand with a little tie so that they don't reach up and touch anything. Of course, like I just mentioned, if we're doing the radial, we are gonna tape their hand down to the board that we're using. And so that's kind of how we're gonna get them exposed, okay? So the next thing, and I didn't write that on, everything else is on here. Talking about the next step is we need to palpate the artery. So we need to figure out where is the artery, okay? I drew on the board, so if you come back here, just come around